lovely ladies and gentlemen. You are welcome to today's health presentation on cervical cancer. There are many women out there that are battling with cervical cancer. If you are a woman out there and you are not having cervical cancer, you can also learn a great lesson from today's presentation and know how to better prevent it. Now today we are going to talk about what cervical cancer is, what are some of the signs and symptoms, who is prone to cervical cancer. Now, when you start experiencing the signs and symptoms, you may like to consult your doctor, but there are preparations you need to do before you consult your doctor. We'll talk about that here. And then also, there are questions you need to ask your doctor that will help you better understand your condition. Don't forget that the doctor is also likely to ask you a series of questions, and you need to provide accurate answers that will help the doctor to know which diagnostic method or treatment method to conduct on you. Now, what are some of the tests available? What are some of the treatment methods available? And what are some of the lifestyle changes you need to adopt that will help you prevent the cervical cancer or to suppress the spread of the cancer cells in you? The biggest question here is, are there natural remedies that you can use to treat cervical cancer at home? Wow, that is what we're going to talk about today. Don't forget to share this video, like and subscribe, because other people must also learn from this. Once again, you're welcome. Cervical cancer is a type of cancer that occurs in the cells of the cervix, that is the lower part of the uterus that connects to the vagina. Now, what actually causes cervical cancer? There are various strains of human papilloma virus that we call HPV. It is a sexually transmitted infection, and this plays a major role in causing cervical cancer. That is it. Now, what are some of the symptoms? Before I talk about that, there's something that I need to let you know. When we talk about cancer, we describe cancer depending on the stage that it is. When the cancer attacks one organ in you, for example, the liver, the kidney, and whatever, then we say you have stage 1 of the cancer. When the cancer cells spread to attack another organ, then you have stage 2 of it. It can continue like that from stage 3, 4, and so on. So when you have cervical cancer at the stage 1, that is around the cells of the cervix, then you have stage 1. At that stage, you will not experience any sign or symptoms. You are likely not to experience any sign at all. But when you spread to stage 2, that is where you begin to see the signs and the symptoms. But what are some of the signs that will let you to know that you have cervical cancer? Number 1, you may experience vaginal bleeding after sexual intercourse. Anytime you have sex, you experience blood flowing out of you. It should alarm you that you may be having cervical cancer. And then also, when you end your period, you don't expect any blood flowing out of you again, but all of a sudden you begin to experience blood flow after your period. That is also another big sign. And then you may also experience watery and bloody vaginal discharge that may sometimes produce very foul odor. It's also a big sign of cervical cancer. Then when you have pelvic pain and then pain during sexual intercourse is also another sign. Maybe sometime you are in your menopause, you've not been having your menses for several years, but all of a sudden you start experiencing blood coming out of you. You may be having cervical cancer. These signs should alert you to know that you need to consult your doctor. But who is prone to cervical cancer? Now, those who are prone are likely to get cervical cancer at this. Number 1, those who are having multiple sexual partners, those who practice promiscuity are likely to get cervical cancer. Number 2, those who start practicing sexual activities at the early stage of their lives. For example, the teenagers. When you start practicing sex too early, you are prone to cervical cancer. Number 3, when you have sexually transmitted infections like chlamydia, syphilis, gonorrhea, HIV, and you do not treat them immediately, they could cause cervical cancer in you. And then sometimes when you have very weak immune system, the moment a cancer cell enter into your system, you may develop cervical cancer or other type of cancers. Then again, if you are a lady and you smoke, please, and you smoke, you are likely to get cervical cancer. Okay, so we are doing this, then you are prone to cervical cancer. Okay, now when you start experiencing the signs and symptoms, what do you need to do? You need to prepare before you see your doctor. The first thing you need to do before you see your doctor is to be aware of any pre-appointment restriction. Your doctor will likely request for any test, but there are some tests over there you are not allowed to eat solid food before the test. You should be aware about that. Okay, so that you don't eat any solid food before you see your doctor, or else they'll ask you to go and come another time without eating before the test is conducted. Be aware of that. Number 2, you need to write down the symptoms that you are experiencing. Number 3, you write down your key medical information. Maybe you are taking some medications previously or currently. Write them down and let the doctor know. Okay, the next one is that you need to write down questions that you need to ask your doctor. Questions that you need to ask you. Write them down. If doctors do not have enough time to spend with one particular patient. There are a lot of patients at the OPD waiting to come in. So if you don't write down all these, you may end up wasting the doctor's time, and the doctor may not have that time for you. Okay, so some of the questions you need to ask your doctors or your doctor is this. Number 1, what is the main or the most likely cause of my symptoms? Number 2, what kind of test do I need? And what side effects should I expect? Or what treatment are available and what side effects should I expect? And I've been reading about cancers and I came across a word, prognosis. What does it mean? Ask the doctor. And then how often will I need follow-up visit? Okay, when I finish my treatment. There are many patients, when the doctor gives them medication, then after they finish the medication, they stop going to the doctor. For cancer, we don't do that. You need to find out when you're supposed to do the follow-up. Then I have other health conditions. How do I manage them together? Then, once again, you need to ask the doctor, are there anything that I need to avoid? Let the doctor know. Then the doctor is also likely to ask you questions. What are some of the questions the doctor will ask you? 1, what symptoms are you experiencing? What are the symptoms that you are experiencing? Number 2, the symptoms you are experiencing, are they severe? Or how severe are they? And have they changed over time? Your symptoms, have they changed over time? And have you had regular pap test? There's a test called pap test. Have you had that test before? Number 6, have you ever had abnormal pap test? If you had ever had pap test, have you ever had abnormal one? The doctor would like to know. Have you ever been treated for cervical condition? The doctor would like to know that. Then, have you ever taken medication that suppress your immune system? There are medications that when you take them, they reduce your immune system. The doctor would like to know that. Do you have or have you ever smoked? And if you smoke, how much? And finally, do you want to have children in future? These are some of the questions the doctor would like to ask you. Now, what are some of the tests that are available? Number 1 is the pap test that the doctor may request for. And then also, during the pap test, the doctor will scrub or brush your cervix area and take the cells and go to the lab with it to find out whether you have cancer cells in it. Okay, then the next one is HPV DNA test. The doctor may recommend that one too, or punch biopsy, or endocervical curettage, electrical wire loop, or cone biopsy. These are some of the tests available for those who are having cervical cancer. Now, what are some of the treatment methods that are available in the hospitals? Number 1, surgery. The doctor may recommend surgery. Then simple hysterectomy. Simple hysterectomy is there. And then radical hysterectomy, radiation, or chemotherapy. These are some of the treatment methods available. Now, what are some of the lifestyle changes that you can practice to suppress the spread of the cancer cells, or if you don't have it, you can practice to prevent it. Number one, make sure you get vaccinated against the human papilloma virus. Get vaccinated against that. Go to the hospital and get vaccinated. That will save you. Number two, make sure you have routine pap test. Always keep going for pap tests. Okay. Number three, practice safe sex. Avoid multiple sexual partners. Do not practice promiscuity. Okay. Then again, do not smoke if you are a lady and you don't want to have cervical cancer. Avoid smoking. If you do, stop, please. And then also read more about cancers. If you do that, you end up preventing it. If you are doing this too, you can suppress the spread of the cancer cells in you. Now, what are some of the treatments available? The treatments available, I've mentioned them, and take note of them. You can replay this video and then listen to them and list them down. Now, finally, are there natural remedies that you can use to treat yourself, or to treat yourself at home, let me say. Now, I'm going to mention some plants, but I'll mention their scientific name. Please go and find them out. Do not ask me what are the common names. Now, one plant called Cromolina odorata. Cromolina odorata. Cromolina odorata is very effective in treating cervical cancer. Now, go and fetch or collect the fresh leaves, okay, either in a basket or whatever, and then dry them under shade or in your room, or you can also use the fresh one. Just collect a handful of it and boil it. Use this as tea, okay. Take 1 cup in the morning and 1 cup before bed, okay. Do that continuously for 3 weeks to 3 months. Do that continuously. That is if you are having cervical cancer. If you don't have, you can take 1 cup a day for 3 weeks. Break for 3 months and then repeat the process again. Now, there's a product, natural product on the market called B Vital. B Vital. Go and search it on the net. B Vital is very effective in treating cervical cancer or all type. Just take 6 bottles, 6 containers of that. You are okay. Okay, trust me. Then again, there's another plant called Terminalia capata. Terminalia capata. Okay. Get the fruit and crack it. The nut in it contains vitamin B17. Vitamin B17 is very effective in treating cancer. Okay, get the nut and be chewing them. Chew handful of it every day. Handful of it every day. You can even get the dry nuts on the market and buy. Okay, then you can also use product that's highly in vitamin B17. Use that. And then also you can also boil cassava roots and eat it with stew, okay, on daily basis for 3 months. You can break for another 1 month and continue again for another 3 months. It will help you reduce the effect of the cancer. Then the cassava roots too, you can cut it to pieces, peel and cut it to pieces and dry it. Use it to make cassava root powder and use it to prepare your meal, okay, and eat with soup. Continue doing this for 3 to 6 months. Your cervical cancer will be gone forever. These are natural and authentic remedy that you can use at home, okay, without side effects. Trust me, without side effects. Ladies and gentlemen, this is the end of today's health presentation, and I'll come your way again another time. But next time I come your way, I'm going to talk about the effect of masturbation in men. Effect of masturbation in both men and women. And trust me, you will learn a great lesson from there. Ladies and gentlemen, thank you for watching this. Don't forget to like the video, subscribe and share with families and friends. Bye bye.